With the permission of Chair, thank you, welcome you all. Today's annual general meeting of Bangladesh Breast Cancer Society, Society for Breast Cancer Study, and it's our great pleasure that we have us among with we have us our president and vice president as well our other members. And today we are going to do a preceptorship program as well for the lung cancer, just following after lunch and discussion of the AGM's topics. But before starting the meeting, we have fixed some few agenda. Among them, we would like to reviewing the audit file for system integrity and compliance, because we have do our registration, TIN registration last year, but we go for the RJC registration in 2020. Since then, the audit report was not done. So after completion the TIN report, we are conducting, engage a firm to do the audit and submit for this financial year. And so we have developed our systems to conduct the conference and other meetings. For this reason, we continuously develop our system, and we developed a conference management system as well as website development. And we'll do online. We have planned for the MDT tumor board running. So we are planning to develop a online tumor board facility. So these three things I need to discuss in brief, very brief actually. So if we go for our first things that we have, this is our website actually, and if we log in our website, we can see our profile where we have overview, media zone, events, which events we participate. If you submit any abstract, we can see. Then presentation, we can upload our presentation directly if you are a speaker, and some payments issues and profile things. So this is our main website, and it integrated not only BSBCS website as well as all the events, current and past. So if we see, each page is actually a website. So we are trying to collaborate all the events from very past. We are archiving our previous things. So we are, this events was previously 2002 events was has in different page landing, but we try to remembering them who came and who gave the which topics. So we try to collaborate in same page. And if we go for the current events, like today is the current event, and this is some past events. So this page landed directly here. What we have the speaker profile here, who the speaker for this program, as well as we can see the direct schedule here, and the participant list, most important. Who enrolled, we can see live them in our participation list. And some abstract, though this program doesn't have any abstract, so we cannot able to see. Some gallery we'll upload later about this program. And again, if we go to our management system, this is the main dashboard actually, from where we can control everything. So this is the event we can create from here. This is the program builder. We have already built a program through this, and what you have seen in the preview, this is built from here. As well as we have participant list for each program, and if we filter the program here, we can see how many participants applied for this, 151 including our EC members, as well as 11 pending requests. As we kept them health, we didn't approve them for this program. We feel that they are not the appropriate candidate for this. So this control is over us, and we approved 139. Among them, 10 didn't pay it. This time, for the first time, we introduced the membership fee for 500 Dhaka for our annual membership, as well as who will have the membership for this program. They are offered for zero payment. So among them, 129 paid, and this list can be seen here. And if we go for the payment method, and here also we can find out the all source, or say we can filter the membership payment. What happened with our membership payment? Among 47 new member paid in our account, and the transfer amount is around this. Later on, if we go for the membership management, again we can manage everyone from here, paid status, mail sent status, everything. So this is a very robust management system, so we can conduct any program from here just on a laptop, to be honest. And if we go for the others, we can issue kits from, today we'll issue the kits from our even mobile device who will attend the conference later on. Later on, we can have some bulk messages. We now email as a group email with our members, participants, and any bulk group, and some abstract approval presentation. These events, one of the presentations already submitted, we can download it here and display. So there is no need for asking the presentation. And the best one is the certificate. We launched the certificate things. So if we see the preview of the certificate, after reviewing the conference, after completing the conference, who will join, they will receive a mail for the program overview and will provide a certificate for the preceptorship program. So these things are very few things, but we are also try to develop a MDT collaboration, and this MDT collaboration online platform we create, and it's an ongoing process actually. So this is the platform who can join together, like someone tried to access a MDT platform from Rangpur, and if he is our member, he can create the things like here, and when he upload his documents, we can see his documents from here, and the best part is image and other things will be, the best part is the overview. That AI generated things will give the overview of this case, as well as disease trajectory and treatment response and risk of toxicity, as well as guideline it will provide through the AI. And if it also suggests about the compatibility as well. And we can see the whole things in a scenario, the stage and other things, the executive summary, the pattern of test results, and what is the best thing of this is like timeline. So we can conduct any of the, this is a project we took last AGM meeting, but we are not able to conduct those things. But with these tools, I hope we can conduct our CME tumor board program now. Even we can create some panelists for the breast, for the lung, for the other disease, national or international, with the time availability. So anyone across Bangladesh can join or submit a case for the tumor board. We can run through our yeah. But this costs a lot. This has this also has a useful tools for the DICOM image as well. It will update it, and hope so any DICOM file we can read. And that's all for the developmental product, but this need for the some financial involvement. So we have to think about that part also. And without much, the next best part is what about our conference in upcoming November. In 2025, the conference was tend to be happened in 2024 November, but we are able to do it in 2025, all you know. So this year is the actual year of 2026 November. 13 November, we already engaged our conference date. So we have to discuss, can we confirm the date, or we'll extend for the next 1 or 2 months later in January or February. So we have to discuss this issue. So from my part, this is the end of discussion, and for the financial disclosure, we'll sit together and discuss how to submit the financial report for the tax return or other things. Our two VAT specialists and tax specialists, they are here to assist us for the account setup or other things. Thank you all. And we can continue our discussion in the lunch session. So we are all requesting you to go to the side room for the lunch, and along with the lunch we can discuss and come for the preceptorship program by 3:30.